thankful that you're here in town on a holiday, but you've taken time to come and talk to us a little bit about breast examination. And for obviously, you're a breast surgeon. You've been in that area for a number of years. From your experience, Dr. Ari, can you tell us a little bit about when do women usually come for a breast examination to yourself? When have you
in the
had
United
that?
States?
Yes.
Yeah. So I actually don't see a lot of women for screening.
Okay.
If a woman has a problem in their breast, they'll probably call their primary care doctor or their gynecologist, and they'll get sent for imaging,
Right.
a mammogram, ultrasound, whatever, and then they'll come to see me after that has been done. So, I will see occasional people that got in before the studies were done, but in general, if they have a problem, I'm seeing them after some imaging or some workup has been done.
Okay.
And it's a cultural difference from Asia. In the United States, everyone relies on their primary doctor for prevention and also to work up most problems before going to see somebody else.
So when we're talking about prevention here, you find that in America, in the USA, that happens more systematically, where someone goes into their primary care clinic, their GP, if you may, here in Asia, and they have a test. And what usually is that test that they have with the primary doctor?
Right. So if we're talking specifically about prevention for breast cancer, really we're talking about what's called secondary prevention, which is looking for cancer early enough to do something about it, or at least something easy. And so in the United States, we're sending those women for mammograms, for screening with an X-ray of the breast. And that starts in the U.S. anywhere between the ages of 40 and 50.
Okay.
And depending on the society recommendations, it could be every year or every 2 years until 69, 75, or death.
Okay.
Depending on the society.